So this is a mental health wake up, mental health moment, whatever you want to call it, for the Central Texas Conference with Youth. And we have on Makenzie Jordan, LPC, who is an amazing counselor in our area. She works with students, youth, however you want to phrase it, and children. And we are looking to her for her expertise in guiding the conversation and equipping us in what we need to know in order to do our jobs best. Now it's time for you.
Awesome. Now the age-old, can I share screen? Okay, I think I got it. Okay. Well, thanks, Christine, for having me today. I'm excited to talk about some things that I'm passionate about, especially with y'all, especially with a church community. So I plan to go over youth suicide prevention today. Before we get into that, just wanted to share a little bit about myself so you have an idea of who is giving you this information today. So just a little bit about me. I am a wife to my wife, Heather. This is a picture of us at our wedding last May. We got married in our backyard, and our reverend at the time, Joy Dister Dominguez, was the one who officiated it, and it was super special. So that is us. My hair is drastically different. That is me on the right. I did get a haircut and went from blonde to brunette. My wife, Heather, she's a professional dancer, Pilates instructor. She's currently finishing school for a doctorate in occupational therapy. So she will be the doctor in the household. But more than that, she's a thinker, a lover of babies and animals, can take a nap at any time of day, and she is wonderful. We currently attend Arlington Heights Methodist Church in Fort Worth. We love that church community, so I'm excited to just be a part of teaching and sharing a little bit of what I love with people who are in the same church system as me. Additionally, I am a dog mom, and I just never thought I would be that person that claims to be a dog mom and shows strangers their dogs. But that is a little bit about me. This is Kai and Heidi. They are both rescues, and they make life very fun and very messy. So if I'm not working, I'm generally spending time with them. And then lastly, I am a licensed professional counselor. And so I've been practicing for over 6 years now. I've spent most time working in psychiatric hospitals as well as some nonprofit settings. All my work has been with children and adolescents over these 6+ years. Currently, I work full-time for a local hospital, and I'm a supervisor for a statewide program that provides free mental health counseling and other services to school districts. When I'm not doing that full-time on the side, I also am a part of a private practice. In that private practice, I specialize in a trauma therapy called EMDR. So I see a lot of clients that have experienced trauma, working through that. And then I see a lot of young adults in my private practice as well. And so just as a disclaimer before I hop into everything, I'm not here representing any workplace of mine. I'm just here as a LPC that enjoys helping and sharing information. So all the information that I share today is based on my clinical experience as well as research. So just a little bit of a warning, as the title shared, we will be going over suicide today. So I just want to give a little bit of a warning. Although it is talking about suicide, we will be mainly focused towards statistics and facts, but that does not mean it cannot bring up big emotions and painful life experiences. So just want to kind of give that warning before we get into the content. Especially since it's being recorded. Take what you would like from the content, take it in small doses if that's helpful. So I brought this topic, Christine gave me free rein as to what I felt like is important to share, especially with people that are working with children and adolescents. And so this was definitely top of my list, was suicide prevention, just based on what I've seen. And these are some of the questions that we're going to tackle today. So we're going to talk about what the statistics say about suicide, who is at risk among youth, what are some suicide risk factors and warning signs, what are some preventative practices for suicide, and how can we help a youth that is at risk for suicide. And all the information I'll be providing today is based on research, but it does not mean that I will hit every single risk factor, warning sign, preventative practice that's mentioned in research for suicide. There is a lot of information out there regarding this topic, so this is just highly condensed version for you. If you want more information, there is some information at the end of the presentation on resources and references. So I definitely encourage you to seek those out further if you would like. Okay, so what do the statistics say about mental health and suicide among youth? And so the first couple stats that I want to bring to your attention are correlated to the pandemic. Of course, that is a major topic the last 4 years. It's shocking that we are 4 years removed from the start of the pandemic. It's still hard to wrap my brain around that. I'm sure y'all have had a similar experience. But so firstly, I want to share that in 2021, after the onset of COVID-19, we had the American Academy of Pediatrics come together with the American Academy of Children and Adolescent Psychiatrists and Children's Hospital Association, and they declared a national emergency for child and adolescent mental health. During this time, emergency rooms at children's hospitals were experiencing skyrocketing numbers of suicide attempts by youth. To put into perspective, with one of our local hospitals, Cook Children's reported in 2021 that it was the first year ever that suicide was the leading cause of traumatic death at their hospital. And so accidents are generally the leading cause of traumatic deaths, but in 2021, suicide was the leading cause. This is a big shift in what we had been experiencing in the hospital systems. Another key stat that had come from the pandemic was global rates of childhood depression and anxiety doubled in the pandemic. And so this was suggesting that 1 in 4 youth globally were experiencing clinically elevated depression symptoms, while 1 in 5 youth were experiencing clinically elevated anxiety symptoms during the first year of the pandemic. So again, I bring those stats. I know the pandemic was, several years ago at this point, but it's still reaping effects and has brought some of the largest statistics regarding mental health for children and adolescents, especially in the US. A couple of these last stats, just want to talk a little bit of the US and then hone in on Texas for just a second. According to the CDC, suicide is the second leading cause of death between ages 12 to 24 in the US. So I almost want to take a moment of silence for that. That is a heavy statistic, that it is the second leading cause of death for these adolescents. And then lastly, in Texas, the rate of suicide mortality continues to increase for youth ages 15 to 29. So this has changed statistically significantly in the last few years. All right, so we're gonna move into a couple other statistics. These statistics are from the Youth Risk Behavior Survey. This came out in, I believe, in 2022, but the survey is based on what was happening in 2021. This is a survey that happens nationally every couple of years. So this is the newest data. We should be getting some new data out in this next year. But this is a national representation sample of US high school students. And so what they found was statistically significant increases in the percentage of youth who seriously considered suicide, made a plan for suicide, and attempted suicide compared to previous years. So in 2021, 10% of high school students attempted suicide. 18% of high school students made a plan for suicide, and 22% of students seriously considered suicide. So all of these statistics really corroborate stats that we just saw of increases of children and adolescents in emergency rooms for suicide attempts and fatal deaths. So those are, general stats about what is going on with children and adolescents' mental health in the U.S. throughout these last few years. Now I want to look a little bit at who is particularly at risk among youth. And so the stats I'm about to give you are compiled from the JED Foundation, and these are stats from December 2023, so these are really recent. And the JED Foundation is a nonprofit that is geared towards suicide prevention of youth. And so I have their reference at the end. They have a lot of great resources. So that is a good website to visit if you are interested in any further information. So who is at risk? LGBTQIA youth, particularly ages 13 to 24, are at increased risk for suicide. And so 41% seriously considered attempting suicide in the past year. And then a stat that I didn't put on there, but is also for LGBTQIA plus youth, 14% actually did attempt suicide in the past year. So this is a population that we hear a lot about regarding mental health. They are particularly at risk for suicide, especially when they are in their youth. Another population that is at youth is Indigenous youth. And so this would include American Indians, Alaska Natives. This is for ages 10 to 24, and suicide rates are almost twice as high as the overall national average. So that's something to just kind of keep in mind if you are to ever work with a family, work with a student that is an Indigenous youth. And then lastly, Black youth, especially ages 10 to 24, are currently having the fastest increasing suicide rates. So in the past, this was actually a population that had lower suicide rates, but this has drastically changed in the last few years. And so just something important to keep in mind. I'm not sure, exactly why that is, but if you really think of what has been going on in the last few years, especially in the US as a nation with some different political movements and whatnot, it can see as correlations to this increasing suicide rates. So a couple other populations that we want to be aware are at youth or at risk. We have young women ages 15 to 24. Suicide rates have been increasing faster than boys, doubling in the last 2 decades. And so again, this is something that has changed a lot in the last few years. We typically have always thought of young males being more at risk for suicide. And so we're actually seeing the statistics change on this. Additionally, youth in rural areas, ages 10 to 24, are nearly twice as likely to die by suicide compared to those in large metro areas. And so again, I don't have exact answers to everything, but if you think about youth that live in rural areas, they have less access to mental health care, such as counseling or talking to a doctor about medication, lack of resources, especially when it comes to mental health. So I know some of the school districts that I work with at one of my jobs, they don't even have a school counselor a lot of times. So that's just something that is hard to come by the further you go out of the metropolitan areas. And then lastly, another group that we know to be more at risk is youth that are involved in the criminal justice system. So this is ages 10 to 24. And the stat is that they die by suicide 2 to 3 times more often than the general youth population. So again, these are just kids to keep in mind when you are meeting these families, that these kids can be more at risk for suicide. Okay, so we'll talk a little bit about suicide risk factors. I have a list here. And so when we're talking about risk factors, again, we're talking about children and adolescents and these risk factors that could show that they are more predisposed to suicide. And so when we are looking at this clinically, we're looking at some of these things as red flags of potential indicators for suicide later in life. And so history of suicide attempts is one that comes up if the student has a history of attempting, especially as there are more attempts, they can be more at risk. Access to firearms or other lethal means. This is something that I'm going to talk more about in a few minutes, but this can be a risk in itself, just having access to weapons. Family history of mental health or substance misuse disorders. So we know the family is struggling with depression, anxiety, alcoholism, anything of the sort that's going to be a risk factor. One or more mental health disorders or substance misuse disorders. Again, if we know the student is struggling with depression as well as anxiety, or any two or one or more mental health disorders, that would be a risk factor. And then some other things would be aggressive or disruptive behaviors, feelings of hopelessness or helplessness, impulsivity, acute loss or rejection, and adverse childhood events. And so if you are not familiar with adverse childhood events, we call them ACEs. And so these are going to be different things that have happened in the student's childhood that could put them more at risk for suicide. So when we think of ACEs, we think of the student experiencing violence, abuse, or neglect growing up. Could also look like witnessing violence in the household, such as domestic violence, or witnessing violence in the community. Could also look like having a family member attempt or die by suicide. It could also look like growing up in a household where there were substance use issues, mental health issues, instability due to parent separation, or household members being incarcerated. So ACEs, there is a list of them. There is an assessment of questions that clinicians ask, and they are asking about all these things. And so we could have a whole other series on ACEs and what that means. But something just important to know is that these can put youth at more risk to things like suicide injuries, sex trafficking, teen pregnancy, chronic diseases, such as cancer, diabetes. So ACEs are something that we really keep an eye on and tend to be risk factors for suicide. So what are the warning signs of suicide? So first, I just wanted to list some depression symptoms. If someone is having depression or is being clinically diagnosed with major depressive disorder, it does not necessarily mean that they are having suicidal thoughts. However, we do know that depression can lead to suicidal ideation. So I wanted to just put on here some typical depression symptoms that we see. So this can look like changes in sleep and appetite, feelings of sadness, hopelessness, helplessness, loss of interest. So loss of interest maybe in things that they used to love doing, fatigue, worthlessness, inappropriate guilt, and lack of concentration. All of those are depression symptoms. Some other warning signs for suicide would be withdrawing from family, friends, and activities. This could look like maybe a student that loved playing soccer is no longer engaging in the sport, or maybe a student that loved coming to youth group and is no longer participating in the youth group. Other warning signs can include decline of activities of daily living. So what we mean by that is things that you do in your typical daily life, such as like upkeeping your hygiene, taking showers, going to school, going to work, attending your regular activities. Declining of these activities would look like not doing these things for yourself anymore, not going to school, not taking the shower, etc. Some other warning signs of suicide would be disinterest in the future, preoccupation with death and dying. So when I say that, I'm saying it could look like maybe Googling about death or searching ways to die. I know that's something that we see a lot working with kids and adolescents, especially in schools because they have the Chromebooks now. In I guess their school systems get alerted anytime certain words are typed into the Chromebook. So a lot of times we'll get referrals for kids because they typed ways to die into the Chromebook. Other ones could be giving away important possessions of theirs, suicidal notes or social media posts, risk-taking behaviors. Risk-taking behaviors could look like substance use, driving cars too fast, getting suspended from school. And then lastly, verbal cues. Verbal cues can look like a lot of different things, but some that come to mind would be like, no one would even care about me if I was gone. I won't be a problem for much longer, or I wish I could just disappear. Those would be some verbal cues. So what are some preventative practices for suicide? So perhaps most importantly would be the storing of firearms and lethal means safely. And so I'm going to focus on that for a little bit, and then we'll come back to some of these other preventative practices. But when we talk about firearms, firearms are the most deadly method when it comes to suicide. And so I will share some statistics about that here in just a second. But then when I say lethal means, that can mean a series of different things. So it could be medications used for overdosing. This is the most common attempt method for suicide. This could be chemicals in the household, like cleaning chemicals, sharp objects like knives, or extension cords, belts, those kind of things that could be used as a means to suicide. I do like I said, want to focus a little more in on firearms particularly. So we'll come back to some of these other preventative methods in just a moment. Although there are multiple factors that elevate the risk of suicide for a person, ultimately their survival may come down to what methods are readily available and how lethal they are. And so researchers estimate that 4.6 million children live in a home with at least one loaded, unlocked firearm. Nearly 90% of suicide attempts with a firearm are fatal. And adolescents' risk of suicide, risk of death by suicide, is more than 3 times higher if they live in a home with a firearm than if they do not. So these are some pretty big statistics when it comes to firearms. A couple other statistics that I did not put on there. Firearms were used in more than 50% of suicides by young people ages 15 to 24, and that was in 2020. And in an analysis of the CDC data across 5 states, nearly 80% of firearms used in suicides by youth under the age of 18 were owned by parents or family members. So again, these are some pretty big statistics. And I know in general, the topic of firearms has been especially controversial over these last several years in our nation. But when it comes to suicide prevention, it is an important topic to cover, as you can see with these statistics. And so what I really encourage people to gain knowledge about is how to have conversations about storing firearms safely. It can be a really uncomfortable conversation to have, even as a professional, but also just as a normal person. These are tough conversations. And so I would really encourage you, there are resources out there of how to have these conversations and have additional training. CALM, it stands for Counseling on Access to Lethal Means. CALM is a great resource and they offer trainings regarding this. I also have that in my resources, but that's just kind of something to keep in mind. If you feel uncomfortable with that conversation or would like to learn more about how to have conversations like that, CALM is a really great resource. Okay, so back to some other preventative practices for suicide. Recognizing warning signs and providing resources for help. This is something that we will definitely talk more about in just a moment, but being able to recognize things that we've mentioned as far as warning signs can be incredibly helpful. Another preventative practice can look like encouraging families towards treatment at early stages of mental health concerns. And this can prevent worsening symptoms that can result in suicidal ideation or attempts. And so lack of access to care can be problematic, especially for families, for children and youth. So it may be a good thing to just kind of consider with your church what funding looks like, such as setting aside funding to assist families to get access to treatment. One statistic to just kind of keep in mind, about 60% of youth with major depressive disorder do not receive any form of treatment. So that is a large number of kids dealing with clinical depression on their own without seeing a professional. Other preventative practices can look like strong connections with family, friends, and community, as well as supportive religious communities. And so I have experienced this myself. I've experienced religious communities that have been incredibly supportive of me. I have experienced other religious communities that have not been as supportive to me. And I do know that the ones that have been supportive with me have overall helped my mental health. So that's something that we want to be able to provide to these youth, or these strong connections, especially in our religious communities. And then asking direct questions, especially about suicidal thoughts, that is something that I'll talk about in just a second of specific questions you can ask. But I know it can be uncomfortable to directly talk or ask about suicide. There are some myths out there that talking or asking about suicide can put thoughts in someone's head. But asking someone if they're suicidal does not, in fact, put them at more risk for suicide. It's actually helpful. It can provide reassurance that it's okay to talk about these matters and can help get them help. So, how we can help a youth that is at risk. Um, the first thing is just remain calm and supportive. Really want to be a listener if you've noticed that maybe a risk is a youth is at risk for suicide, making sure that you are providing that safe space to be able to have these conversations. We want to listen non-judgmentally, ask questions, ask open-ended questions, ask about their experience, and then really listen to what it is that they're saying. And as I mentioned a moment ago, asking direct questions can be helpful. And so if you have a student that you're worried about, you think maybe they're at risk for suicide, they're exhibiting depressive symptoms, maybe you've heard them say some things that were concerning, it is okay to ask direct questions. And these are some that you can ask. Are you thinking of harming or killing yourself? Have you ever thought about harming or killing yourself? Have you thought about how you would kill yourself? Do you have access to any firearms or weapons in your home? So these are good questions that can be asked just to gather information. And again, it does not put youth at more risk for suicide. Additionally, something to kind of keep in mind if you're having these conversations and you are concerned whether you know them to be suicidal or not, don't leave the youth alone. I would have that discussion with their parent or guardian. I'm assuming y'all work with people who are under the age of 18. So if that is the case, then make sure that you are involving a safe person in their life in that conversation so that they are able to get the help that they need. Additionally, on there, I said taking to a facility for an evaluation. What I mean by that is if for some reason there's no access to a parent or guardian, or let's say they're 18 or older, a facility would be like a hospital, taking them to a hospital to get checked out if they are feeling suicidal. And then additionally, what we can do to help is determine protective factors, coping skills, supports for them. So when I say protective factors, these are factors that one considers to prevent them from suicide. So sometimes this can look like family members, friends, pets, obligations. Other times it can look like wanting to graduate high school or not wanting to disappoint my parents. Those would be protective factors. Coping skills would be more of the skills that someone would practice when they're managing their distress. And so this could be like talking to a friend, playing a sport, listening to music, exercising, whatever it may be. And so really talking through with the student of what are some protective factors for them, what are some coping skills for them when they're feeling overwhelmed or distressed. And then determining some supports, who would be safe people in their life, who can they talk to when they feel like things are bad, who's a list of people that they can go to if they were ever in need of finding help. So those can be some good things to kind of talk through with them. And then lastly, providing resources. Your role is not to be a clinician. Your role is obviously to do your job and support these students. And so all of these things can be helpful to know, but at the end of the day, it's most helpful to direct them towards a professional. to be able to get the treatment and care that they need. So when I'm talking about resources, I just want to kind of give you an idea of what that looks like, especially if we're talking with families. If we have students that we are concerned about for their mental health, especially if we are worried they are suicidal, that's when I would suggest giving crisis resources. And so I can definitely work with Christine on what that could look like for y'all. But just kind of general knowledge as crisis resources would be like a local emergency room, behavioral health hospital, or hotlines, like the suicide prevention hotline. And then non-crisis resources, those would be things such as like outpatient therapy, seeing a therapist once a week, talking to your school counselor. Those would be more appropriate when a student is not currently having suicidal ideation, is safe in their environment, safe in their home, do not feel like they are at imminent risk for suicide. So again, here's what some crisis resources would look like. So local emergency rooms, and I'm thinking specifically the Fort Worth area just because I'm located in this area, but that would look like Children's Hospital, JPS Hospital, any of the ERs around here or in your area. Again, some local behavioral health hospitals that are in the Tarrant County area would be like Mesa Springs, Perimeter, Millwood. And then these would be some hotlines. MHMR, Tarrant County Crisis Line, again, that's Tarrant County based. And then there is the National Suicide Prevention Line, and that's just a 988 number. So questions that we answered today, just a quick recap. What do the stats say? So the stats say that children and adolescent mental health have had concerning trends in the last few years, and that suicide is the leading cause of death amongst youth. Who is at risk? We discovered that certain populations of youth are more at risk for suicide. So keeping your eyes on any students that may be a part of those populations. What are some risk factors and warning signs? There are many of those, many factors, but recognizing them and addressing them can make the biggest impact. And then what are some preventative strategies? The two main takeaways are reducing access to firearms and then providing support and resources. So getting them the help that they need. And then how can we help a youth at risk for suicide? You can ask direct questions and then ultimately connect them to a professional. Yeah. So if you have questions, please reach out to me. I'm going to put my Gmail up here in just a second. Here are some references for y'all. Give you a second that you can pause, look at it. And then thank you all so much. I hope y'all found this presentation helpful, especially in the daily work that you do. And if you need anything from me, you're welcome to connect with me at my Gmail. I have it on the screen right there. And so you're welcome to reach out with any questions, or if you need any help with resources or anything like that, please reach out to me. Thank you so much.
Thank you, Makenzie. I know that our next meeting, I think it's in October, but I'm not 100% sure. So I'm very excited to continue sharing your gifts and graces with other people so that they can be more prepared for their call in ministry. We are very grateful for your time.